Long-term quality of life after peroral endoscopic myotomy remains compromised in patients with achalasia type 3. Introduction. Achalasia is characterized by loss of coordinated esophageal peristalsis and failure of the lower esophageal sphincter, LES, to completely relax. High-resolution manometry distinguishes three subtypes. The Eckardt score evaluates clinical symptoms, but not quality of life. The treatment aim is to decrease the LES pressure and the integrated relaxation pressure, IRP, in order to improve symptoms. Medical and endoscopic therapeutic options have limited efficacy. Laparoscopic Heller myotomy is considered the gold standard of treatment, but peroral endoscopic myotomy, POEM, has gained popularity because of its excellent safety and efficacy. Success is defined as Eckardt score less than 3, IRP less than 15 millimeters of mercury, and greater than 80% emptying of contrast at 5 minutes in TBE. When these have been achieved, the patient's quality of life should be improved. Excellent clinical outcomes have been reported in the short, medium, and long term, but there is little information about long-term quality of life. Moreover, 10% to 15% of patients treated with laparoscopic Heller myotomy show a medium-term decrease in quality of life, QOL, scores, following early success, thus generating doubts about the direct relationship between procedural success and good quality of life. In addition, there is no information about any differences based on achalasia subtype. Among different methods used for the evaluation of quality of life in achalasia, the short-form health survey, SF36, shows low specificity, whereas the disease-specific AE18 questionnaire shows high sensitivity and specificity. Our primary objective was to evaluate quality of life before and in the medium and long term after the POEM procedure. Secondary endpoints were to evaluate the relationship of quality of life to the classical evaluation methods of Eckardt score, IRP, and timed barium esophagogram, TBE, to explore differences between subtypes and to find whether there are factors associated with low QOL scores at long-term evaluation. Background and study aims. Peroral endoscopic myotomy, POEM, is an excellent endoscopic treatment for achalasia. Clinical and manometric parameters are used for evaluation and follow-up. However, clinical success does not guarantee high quality of life, QOL, scores, generating doubts about their direct relationship. The authors aimed to evaluate QOL scores before and after POEM at medium and long term, to evaluate differences between achalasia subtypes and find which factors related to low QOL scores. Patients and methods. Achalasia confirmed patients undergoing POEM between February 2012 and November 2016 and completing at least 1 year of follow-up were included. Assessment before and at 1, 6, 12, 24, 36, and 48 months after POEM employed manometry, barium series, Eckardt score, and the AE18 health-related QOL scale. Demographic, clinical, and procedure characteristics were documented, with comparisons between subgroups. Multiple logistic regression analysis was done. Results. 65 of 88 patients were included, 38 women, 27 men, median age 47 years, interquartile range, IQR, 20 to 81, and 50, 76.9%, completed 4 years of follow-up. Eckardt score improved. Median pre-procedure 10 versus post-procedure 2, p equals 0.002, and this persisted. There was initial improvement in median integrated relaxation pressure, IRP, 29.4 millimeters of mercury versus 10.3 millimeters of mercury, p equals 0.000, and median QOL scores, 40 versus 68 at 1 month, p equals 0.002. However, IRP increased and QOL scores decreased. Men with confirmed type 3 achalasia had low QOL scores. Conclusion. All patients had significant clinical improvement after POEM with medium to long-term persistence. Though quality of life and IRP initially improved, they deteriorated in the long term. Male sex and type 3 achalasia seem to be associated with low QOL scores.